Yeah, good evening, everybody. Thank you for patiently waiting with us. Today, we have very interesting occasion today. Today is International Men's Day, and we thought that we should have a program dedicated to the men today. And today we have Dr. TSS Rao, also popularly known as Total Sex Solution Rao today, who's going to chair the session on this important occasion. Dr. Rao is the professor of psychiatry at JSS Medical College. He also champions by running a course on sexology. He's right now the honorary secretary of Indian Psychiatric Society. He's actually held various positions at the state, zonal level. He's also served as a honorary editor. He was also the editor of a psychosocial journal. And Dr. Rao specializes in sexual health. Rightly so, Dr. Rao is going to chair today's session. Today we have two important luminaries who's going to talk on today's important aspects. Welcome to Dr. Rao. Dr. Rao.
Thank you very much, Mahesh.
Just a few housekeeping notes today, sir. All the important questions that you'd like to post, please put it in the Q&A section. Dr. Rao will be actively looking for questions there. Any other comment in chat box could be missed. So please put your questions and queries only in the Q&A section. Over to Dr. Rao on this very important occasion and very important deliberation today. Thank you very much for being with us, sir.
Thank you very much, Dr. Mahesh. At the outset, I welcome you all for this celebration of International Men's Day. And in that, very specifically, the area of sexual health has been chosen for deliberations. At the outset, let me thank Dr. Mahesh Gowda, Dr. Vijay Harbishettar, Dr. A. Jagadish A for all instrumental in propounding this telearog, and they are doing a human service, reaching people in each and every state, every corner of the country, and maybe many places outside India. And it is one of the extremely great job that they are doing, and I compliment them for this work. When Dr. Vijay Harbishettar mentioned to me that can we do something, suddenly two names came to my mind, my mentor, and I'm labeled as Manasuputra of Dr. Brahmabatt. I'll talk about him for 1 minute later, and Dr. Neena Sawant, who readily agreed to be part of this particular deliberation. Before I introduce the speakers, maybe one or two small points related to why this International Men's Health Day is necessary. We are all well aware that among the vulnerable, we used to speak about the women, all the issues related to it, and one area which used to get neglected, that part of her, WOMEN, that men never used to get emphasized. And time came when people started realizing that men also suffer, and their health also is extremely important. I'm seeing this WhatsApp, one of the picture wherein the man is lying down and lifting the child on his leg, and wife standing behind, and the child sees mother. Father is nowhere in the picture at all. And on this particular day, in fact, there are plenty of messages are floating around to see that, in fact, to bring to focus that man is also one of the equally responsible person. And developmentally speaking, his role is also one of the very, very important aspects. Coming to men, the health in general and maybe sexual health in particular, there are a lot of issues there. Developmentally, I almost always use the word that the stronger sex is actually the women or female sex. Men are weak, and this particular problem starts from the very beginning. That Y sperm, very weak fellow, maybe 24, 48 hours he can survive. 70% of the natural abortions are attributed to the male sex. Emotionally, he can't express, because of which gets into range of what we call psychosomatic and other related disorders. And when we try to look at in the end, additionally, in fact, the drugs, maybe alcohol and lot many other things add to the complication. And many women are surviving much more longer time than actually men. coronary artery disease, communication disorders, and you name so many these things. In fact, one of the major important common area is actually the men and related problems. In fact, I was jokingly recollecting one of the idea that if you remain single, chances of dying by coronary artery disease is extremely common. And as a married man, I can tell you, married men are more than interested in dying than actually, in fact, being alone and suffering that way. What it means is so much of effort and, in fact, adjustment and related issues are necessary to be tackled. With these few words, in fact, mental health, what we are actually really focused on, and sexual health in particular, which each of the speakers are going to talk about, is quite interesting. And this is really good in the sense that somebody speaking on men and related issues, there is another woman's perspective to it, what actually, in fact, going right and wrong. In fact, one can look at each of these type of things in a very detailed way. To introduce Dr. Raj Brahmabatt, in fact, it is one of the extremely pleasant job, and his biodata runs into many pages. I won't go into the details, except that he inaugurated our 1997 sexual clinic in Mysore, had been a consistent participant in Indian Psychiatric Society programs of maybe Karnataka, zone, or national level programs. I have been groomed by him, and our first sex education magazine, Debonair, in fact, he's one of the very regular columnists to it. Apart from that, in fact, he's the director of Kama Institute of Sexual Studies, Youth Health Counseling Center at BCJ Hospital, consultant at Nanavati Super Specialty Hospital, a family planning association, in fact, SCCRT, Sex Education Counseling Research and Training Center, Pioneer Award, so also the Lifetime Achievement Award, Golden Lamp Award, that way, in fact, so many awards to his credit, has been a very active member of IMA, and in fact, at least about 4 orations, which I can recollect immediately, has been part of South Asian Society for Sexual Medicine, World Psychiatric Association, in fact, SARC Psychiatric Federation, and each of the program, wherever I am associated, in fact, has been one of the person almost very closely we have worked. And he is there to speak on men's perspective. Regarding Dr. Neena Sawant, I think later also we can introduce, but let me finish off this brief job that I heard her presentations in quite a few programs, and what impresses me is actually who can make looks, in fact, sexual medicine as such a simple, easily understandable, very lucid way one can deal with the problems. In fact, these are a few of the very, very interesting things. Very recently, we had these clinical practice guidelines, those which are related to the laws and other related things in the sexual medicine. She was one of the major contributors for that presentation. She is currently working as professor, additional professor as at Department of Psychiatry, KM Hospital. Somehow KM and sexual medicine, there is a strong association. In fact, every sexologist in, I think, Mumbai, directly, indirectly, they are associated with this major institution. She is a consultant psychiatrist at the global hospitals. Her areas of interest, sexual medicine, child psychiatry, and neuropsychiatry. She has authored 5 books in vernacular language dealing with parenting and other related skills, and has more than 75 national and international publications to her credit. Both of them, very difficult to, in fact, we have to talk to them for a few minutes, we have to shell out thousands of rupees. We have to wait for appointment for a pretty length of time. They are with us, and we are really grateful. Personally, Telearoga Group and myself and each and everyone who is listening, that their words would carry a lot of weight and make plenty of meaning, and we are looking forward to their presentation. Dr. Raj Brahmabatt, sir, for you.
Good evening, friends. Can you hear me?
Yes, yes, we can hear.
Good evening, friends. It is just post Diwali and New Year has just started. So let me wish all of you a happy New Year and let all your dreams come true. Today, I have been asked on this auspicious day of Labha Panchami to talk on a man's sexual health, a male perspective. And before I start, there is a Shakti, Dr. Neena Sawant. So salute her to be with us in the male sexual health program. And I start my today's presentation. Male sexual health or Men's Day. There are sporadic things were happening around 1960, but you'll be happy to do around 1999 or close to that. In West Indies, surprisingly, Dr. Jairam Trilokchan, on his father's name, he started that this 19th November should be made as a men's sexual health, men health day or men's day. From that time onwards, but let me share with you, for the main sexual health, our Muni Vatsayan has thought about it 300 AD. So we are much ahead of it. And what he gave a Kam Sutra, till today, one of the best manual as far as the male sexual health is concerned. It talks about foreplay, positions, Vajikaran, that is like a sex tonic, Apadravya, and so many other sexual behavior. Friends, it was a 2004, Dr. TSS Rao invited me at the 56th annual conference. And there I said 11:30, 12 was my talk was over, and by evening, it was in a Mysore mill, called to bring out sex out of the closet. During that time, my friends, andrologists and urologists, they were hijacking the sexual medicine. They were making it like a plumbing job. I said, why it should not be made in my talk in sexuality yesterday, today, tomorrow, a part or a subspecialty of psychiatry. As Dr. Rao has said, he's the pioneer. What they call it is a total sex solution. He's my Manas Putra. We have relation for last 25 years. He started his first talk from Mandya, and as he rightly said, that the first sex clinic, which was opened at the JSS Medical College in 7 years, along with him, Dr. Brugesh Vaishnav and myself had worked tirelessly to bring this particular subject of sexuality in a psychiatry in a big way. Recently, about 15 days back only, there was a big inauguration of the JSS Academy of Psychosexual Health for fellowship and certification. I think Dr. Rao, what he has done is a man of action. He needs a big applause, and I'm really happy, Dr. Rao, that I wish that you start this lamp which you have started, let it spread to all around India. Now, health, everybody knows about WHO, it's a bio, psycho, and social. And when we say social, I talk about the interpersonal relationship in a big way. Sexual health is an integration of somatic, emotional, intellectual, and social aspect of sexuality. The word sexuality is important in a way that are positively enriching and enhances the personality, communication, and love. We were all born with a clean slate. Family, friends, school, education, college, first sexual experiences, the type of religion and the country where we live and the legal aspects of it all makes what we are today sexually. Every one of you know the ideas of psychosexual development of Freud, but what Anna said, sex is something you do, while sexuality is something what you are. It is a total personality, total person, and that is what sexuality we are going to talk today on the sexuality health about it. Lifestyle diseases are all known to you. Just now, Dr. Rao enumerated, and these are due to the junk food, smoking, sedentary lifestyle, and so many things. And apart from that, there are medication and surgery which can create a problem. You open any textbook, and there are a lot of things written about the male sexual health, particularly when the prostate clinic and abroad. There has been a regular lung checkup for the smokers, and also the colon checkup regularly done for the male. Corona time, this is the time, it is a time that men are more sensitive than the woman, and you find more number of the people have got a mental problem and they have got a stress. Now men are more sensitive than a woman, and that's why we get a movie like uh, this one, Bengali movie. What is that fellow one who gets drunkard and other things, Devdas. So that is what is happening. But from time immemorial, we have been thinking man as a full of vitality, vigor, strength, aggressiveness, positive, and can do anything on the earth. And female was considered as a weaker sex. This stereotype has to be broken down. Now, there are many stereotypes which were there about the male and female. I may be breaking. There is nothing like a white and black. There are in between gray areas. Maybe I may be making some statements which are observation of my 40 years of my practice. And particularly in an Indian scenario where I have seen the culture, religious, family, everything comes into the play. Today's women, their economically independence, permissive sexual attitude, contraceptives available, easy legal abortion available, and morning after pill has made a different woman than what she was yesterday. Now, in case of woman, right from the first period, that is menarche, pregnancy, then contraceptives, lactations, menopause, HRT, and old age, every time she has, she has been going to doctors, and there is a treatment seeking behavior. While a man walks like a lion up to the age of 45, 50, and suddenly he realizes that he has got a diabetes, blood pressure, heart attack, lot many things which are happening. And unfortunately, women, the mother and daughter, they are more open to each other on talking about sexuality aspect. While only 11% of male they had been talked by their father, or what we call a study of the male to male talk. 1975, the life expectancy was 50. Today it has gone up to 75, 80. And what happens that men play football at 25, 40, tennis, 60, golf. And as you go older, the balls are getting smaller and smaller. But man is always interested in the balls. Age is just a number. Pablo Picasso, Charlie Chaplin, and Hussein, they were sexually active even in the 8 decades of their life. Man all the time thinks sex, sex, and sex only. While in case of a female, she tries to find it out how to escape from the sex. Now, Masters and Johnson model is known to everybody. There is a refractory period during which any amount of stimuli is given. There is no sexual stimulation that will not help into another orgasm. While female are multi-orgasmic, meaning by female are much stronger than what the male are. Now, DSM-5 has given desire phase problem, orgasm, arousal, and pain. These are known to everybody, and they are available in any books of, a standard textbook. What I am going to talk is the common sexual myths which are copied from one generation to another. And as a psychiatrist, sometimes in a busy OPD, you try to label them as anxiety, depression, obsessive compulsive neurosis, or normal personality disorders or psychiatry. But you must go into the detail and find it out. And there are certain myths which keeps on coming today because of the sex education and the availability of the discussion on the sex. They have decreased, but they have also created many more myths right now. And tomorrow we may be getting a maze on the some myths on corona. There are a lot of religious influences. It can be Hindu or even Tukka Christian, which has, condemned masturbation like anything. Dr. N.H. Wick, who gave a world Dhat syndrome, you go to any newspaper, you open any newspaper, go to bus stop or the railway station, you'll find a big hoardings, and those quacks are flourishing. And why that is flourishing? Because we as a people have forgot that male sexual health is a very, very important aspect of it. Penile size anxiety. 2 years back, I had a person who did not got married even 28 years because next door Bhabhi just told her that you have your size of penis is just like a cashew nut. And it has so much of trauma. So whenever somebody, a female partner, wife, or a paid sex worker, or a friend gives some sort of a say a derogative remark, it affects the male like anything. 2004, when 2000 psychiatrists were there, and I was the only sexologist I presented. Apart from taking the sex as a subspecialty, I presented anti-syndrome. What I have found in my practice that there are a number of women who are only at home. Previously, you say Sali is Adi Garwali or Bhabhi ji ghar pe hai. There was a relationship. Now the joint families are not there. Husband is going out, he's out of country, she's all alone. The idiot box is teaching them all, any soap opera you see, they show everybody sleeps with everybody. So she feels that there is something wrong with her. And the easiest way is out is their either next door neighbor's son, or maybe somebody, sometimes in one case, there was his son's friend was there. And he used to come and enjoy. Auntie used to give lot of, favors in terms of the sexual act. And when it came to his marriage, he felt कि मुझे पूरा खत्म कर दिया है, मैं सक हो गया हूँ, अभी मेरे में कोई ताकत नहीं है. So there are lot many people. These are just an observation, and I have got 8 to 9 cases on it. Today, the most important part is a mobile phone, internet, and pornography. Last year only, there was one of the doctor's son who went for a honeymoon to Bali, and all the way came back. He was hooked to pornography and particular site where the group sex was shown. And he could not perform with his wife because all the time he needed a stimuli to have a group sex. Now, let me say over here, there are a lot of myths about the sexual orientation. First, sexual encounter with the same sex, male with male or female with female, does not mean that they are homosexual. And there was one boy who failed twice with his different girlfriend, and then he thought that he's a homosexual and started thinking of this line. So there are many myths surrounding the sexual orientation. One of the film stars who had come to me, and he was getting bald, and he's taking, instead of 1 milligram, 2 to 3 milligrams of finasteride. This is most dangerous drug. It has knocked down his physical, sexual ability and desire for 1.5 years. It took a very long time to come up. Now this is one drug, but there are many drugs are there which can give rise to sexual problem, which we'll talk later on. 1998, where Dr. TSS Rao was a co-author, and this was a Therapy of Common Sexual Problem handbook. 44 authors had given their contribution India and abroad. Dr. N.H. Week was one of them, and it is the first of its type in a SAARC country. And there I had given a complete chapter on first night or Suhagra. Western countries, there is nothing like Suhagra. While in our literature, our film, it has been glorified, and failures are occurring. I said 30%, and today also 30% failures are occurring, but it is due to different reasons. Virginity is no more a virtue right now. They don't consider, and so many times in the past it was happening that the boy and girl were meeting for the first time. Today they have a live-in relationship, they have enjoyed sex with a couple of people, they have lost virginity, they have been very honest to each other, but they are carrying the back luggage with them, either the good or bad experiences, and many problems start from the first night. Education, career, then after that the late marriage, and suddenly they realize that their image is lost. There is some of them, they don't want a child, but there's a social pressure, and they do not want to have a baby. But again, there is a mushroom industry of IVF around all the parts of India I have seen. They have no time to talk to. There are unconsummated marriage, and they just want to put them onto IVF treatment. And on a 14th day, when the ovulation is occurring, right from the morning, the man is put into an anxiety. So there is a fear of failure, performance anxiety, and spectatoring role, and invariably he fails. Not only that, but he has to go through twice or thrice a very traumatic experience of giving a semen sample. So this takes up a lot of toll of a male. Extramarital affairs, the grass is always greener on the other side. And let me make a one blanket statement. This is very, very common. More number of male are working in the office or at other places, workplace, where they are working for some goal with a female partner than they are in their own home. Secondly, I dare say a statement that everybody, either intellectually, emotionally, physically, or sexually, or spiritually, attached to somebody as far as the extramarital affairs are concerned. And this is unfortunately rampant. And the day when it comes out, it blasts, and it will come down one day on the top of the Eiffel Tower. So one should be prepared for it. It leads to marital harmony and divorce. And if you go into a good lawyer, it's all right, but otherwise date pay date 7, 8 years. And at the end of the divorce, the male, because there are more number of laws which are in favor of women, rightly so. But the male at the end of the day, mentally, physically, sexually, financially, socially, is totally good and is not ready to get married for the sex time. Thanks to Lolita and Pinky Virani's bitter chocolate, we have been very much aware about the female sexual abuse. What about the male sexual abuse? I have made it a point to ask two things. One is about the child pornography, and another is on a sex abuse. And you will be shocked to know by their home servant, cousins, uncles, teachers, neighbors, and that trauma they carry for a very, very long period. Aging, I say sex has no expiry date. But as the age advances, one needs a direct stimulation to get an erection. And that's the time the female partner starts thinking that previously, the moment he used to look at my body or touch my body and he used to get an erection. Now, what is wrong? Am I not beautiful or he is interested in somewhere else? So, aging has created a problem. And particularly in our country, for a widower, it's a very big problem. Where to go for a sex? They have a good position, and I have number of people every day in the morning they may do Vishnu Sahasranam, whatever sort of a puja and other thing. But they say, doctor, once in a while we are a human being. Our partner has gone at the age of 50, 55, what to do? And the only solution is the sex toys. Fortunately, there are some shady shops in Bombay where these are available. Before talking to you people, I just inquired with my legal expert, and he said selling the sex toys are punishable under Indian Penal Code, but keeping for personal use are not at all, punishable. Now, desire part, this is going down like anything. One side, the female desire is increasing day by day. If I remember 40 years back, my first 100 cases, only 5 women accompanied their husband and 3 said they have a problem and they were interested in desire. Otherwise, they say, एक बच्चा हो गया, बाद में sex नहीं करेंगे भी चलेगा. But today, they catch the, from the neck their husband, they find it out my number, they bring it to me. And during this corona, 33% of my work has increased because husband is all the time 24 hours at home in last 5 to 7 months. Previously, either they were meeting only at the airport. Now they are 24 hours there, so sexual desire in female has increased. And all glossy magazines, loose talk has given them idea that I should have a multiple orgasm, the earth-shattering, orgasm, and which is not occurring, which is giving a lot of pressure to a woman. Even in 2004, there was a young girl who came all the way with her husband from Lucknow to find her G spots. So today, Google Guru and WhatsApp University has created many more sexual problems than they were. They just come to a clinic and they say, Doc, I have got an ED, as if he has got a PhD. Premature ejaculation. Once upon a time, it was difficult to treat. Right now, tricyclic antidepressant, SSRI, tepoxetine, opium derivatives, local anesthetics. At the same time, sprays are available. Some Korean creams are available. Some operations are available. And Masters and Johnson's classic behavior therapy of stop at start and squeeze technique are there. This is available. This is one of the commonest problem, but people don't understand. They come with the ED problem, but no, it's not an ED problem. Person got a good erection, but within a fraction of a second, he ejaculated and the penis went limp and he could not perform. So it's a very important part in the history. This was a wonderful study by Massachusetts male studies of 8 years on erectile dysfunction. It was 1,290, people were taken in that studies. Now you see 40% have diabetes mellitus, and India is a capital of diabetes, and vascular disease 30. So 70% of the cases, it's an endothelial problem, the nitric oxide which is liberated. And recently, 3 people were given a Nobel Prize because of they found out nitric oxide. Endocrine disorders are 6%. When I started my clinic, I had given tons of testosterone. Before you take any testosterone preparation in the hand, just find it out biological and chemical, findings that there is the testosterones are required. It can help in desire, some role in the doubtful role in ejaculation, and very role in erectile dysfunction. The radical surgery on the other side, the prostate surgery, spinal cord injuries, any operation in the brain areas, this can, and particularly the blood supply and nerve supply, which are in the pelvic area, if they are disrupted, person comes down with the erectile problem. And if you give them a good counseling to all the people in the male's health clinic as well before the prostate operation, that they will have a dry erection, I think that is the most wonderful thing one can do. There are antidepressant, antipsychotic, and many drugs which can give rise to sexual problem. Now, which drug and how long they will give, it's a very big question. But whenever you start anybody with a drug for a long term, just find it out what drugs they are taking, number one. And secondly, ask them two questions. How is your sex life? Whether you have a good desire, you get an erection, it is being maintained, you are able to penetrate, you are able to ejaculate, reach an orgasm, do you have any pain? And are you getting a morning erection? And are you able to fantasize? And are you able to masturbate? And if there are any problem, please call me. Don't say that this drug will give a sex problem. They'll throw away drug and throw you away. Fortunately, PDE5 inhibitor has given us a large number of drugs. Every month or every year, there is a new drug coming up. One thing you must keep in the mind that it is absolutely contraindicated with nitrates because it causes a profound hypotension which can be irreversible. That's the only thing. Otherwise, they are very, very safe. Each drug has got a age over other drug as far as the side effects are concerned. You must find it out the habit of a person, not only a person but his wife also or a partner also, and then according to you can give. This is the best drug which are possible. ED treatment, there are first line changes, lifestyle changes, first line therapy. Like I want you to focus on 1970 sex therapy and erectogenic agent which has come. Second line are invasive intraurethral and the self injection. Third line are surgical operation, short wave therapy, and gene therapy which are in the pipeline. But I want you to focus on a sex therapy. Now I want to, and before I end, I would give you one case study. J. Kaur and H. Singh got married at the age of 35, 36. Within a short period, they found that they have an erectile dysfunction. Leading homeopath, they went because the family believed in homeopathy. Accidentally, they found a gallstone. For 2 years, they were treating for gallstone. No result. Then a leading psychiatrist of Bombay was seen. He counseled and found that some low testosterone from useless laboratory was there. And that was not even a morning sample. And then it was sent to endocrinologist. He did MRI, found a microadenoma, but he sent it to a neurosurgeon. And he said, keep a watch on vision. There is no need to operation. At that time, he went to one of the leading urologists of India. He rightly diagnosed you are normal. He wrote down PDE5 inhibitor, forgot to tell him how to take it. And he just forgot to tell him that you need a good stimulation. Then ultimately, again, somebody sent him to another endocrinologist. They did a sleep apnea test. Let me tell you, sleep apnea and vitamin D has been found to be somewhere useful in or they are the erectile dysfunction. They are the important things to be seen. Keep it these 2 points in the mind. Then they went to Ayurvedic doctor. Shilajit and Suvarna Basma and whatnot was given. Then infertility specialist, he at least had a courtesy to examine him and found that you need a prepuce right and circumcision. And lastly, went to marriage counselor because they started eating. It took 8 years and now they are with me right now. Let me tell you, friends, this was the most wonderful drug. I said drug of the century. And I myself and Dr. TSS Rao were one of the, I was a chief investigator, and along with us, we had done one of the brand's companies, sildenafil citrate. It's a beautiful drug. But people feel that it's a rampant or it's a magic pill, just give one pill and you get an erection. Forget about it. It's a lot, many years thoughts are there in the mind and it cannot be washed away with a one idea or one tablet. Tell them, give them some people wants to start higher dose. I start with a lower dose of my choice, depending upon the case, and then build up and bring them over the year. Not that you prescribe them for 1 month and see them after 1 month, because that does not work. And the most important part, tell them to stimulate locally. If they don't stimulate, the drug is not going to act. Friends, Masters and Johnson sex therapy, which was there in 1970, we call it a sunset focus, couple therapy, talk therapy, touch therapy. Now, you cannot leave 15 days and go and be at the center. So I have converted sunset focus into exercise, which I go and teach, because what I have found, in fact, I felt like keeping a board outside my clinic that I only treat Viagra failed cases. Because as you saw in that last case, People see them in the parts, in pieces. They don't see as a whole person, you know. And I was realizing that before the advent of PD5, how I was making my clients all right, and I found that it is a sunset focus. I have converted into an Indian model. Instead of co-therapists, I only do, and in case the female examination is required, I send them to gynecologist or my wife, she's a physician. Couple is a must because there's nothing like an unenrolled partner. I say even a single person comes, either they are unmarried, they are a widower, they don't want to tell their partner, institute or hotel. Most of them they remain at home, except 2 or 3 cases who came from abroad, from Dubai and USA. They were kept in a nearby hotel because they were on a short-term therapy. Now break from the routine here. Routine continues. So in a joint family, nobody comes to know. Referral not possible. I can refer them to a diabetologist, endocrinologist, get the test done. In Masters and Johnson, it was a 2-week program. Mine is an ongoing program of 10 to 15 sessions, which are spreaded. Sometimes she's in the period, sometimes he's out of town, sometimes there's a marriage ceremony. It is a time bound. No, it is a flexible 30 to 45 minutes, and whatever roadblock has come, unless I remove it, I will not. So time which I give is, I think, one of the most my unique selling features, and that's why people get solved right. Family not involved. In India, there is nothing like a uninvolved family. Family is totally involved. So one message I would like to, if at all, don't talk to any family member alone. Say that it is very confidential between me and client. If you want to talk, get in permission. And not only that, if there are 2 in-laws on both the sides, say that all 4 of you come and I'll talk to you in presence of that person who is concerned. Never try to do alone, otherwise on your name they say anything. No pharmacotherapy. Today we are so lucky, every day new medications are coming. Surrogate partner. Some people have tried to use it in India. They have a very bad slap on their face. It is medically, legally, morally, ethically wrong. I would never use it. Marital guidance not given. Marital guidance is very, very important. There is nothing like an uninvolved partner or marital disharmony. Vacation is lost. Here after the treatment, second honeymoon is possible. And one more thing which I did, and I request all the psychiatrists, if you can't do it, ask your counselor or subordinate to teach them relaxation. You'll be saving lot of anti-anxiolytic and other problems. So this is one thing, let me tell you, I have put it on this exercise, and I say, lastly, let me say, what you need is an holistic approach. Time has changed. Today we are in the stress century. That previously what was a stereotype or norms that has gone. Marriage Institute may or may not remain, that the time will tell. But I'm still hopeful that it will remain as far as India is concerned. What is happening today? The whole culture is pub, puff, and pizza. It is materialistic. The man goes hungry out of his house. So whether the car is sold or a coffee is sold, it is sold with the female body. And that's why it is very important that you have to, rather than looking outside for your sexual gratification, see in your own house. It is better to grow roses in your own garden than look outside. And why sex? It's a very, very most beautiful thing on the earth. It's a God's gift. And man's sexual health, it is a very, because his whole personality, his soul self-esteem lies in his sexuality. And what sex will do, apart from enjoyment and pleasure, second thing, it can give bonding, closeness, intimacy, relationship. It also takes away the pain. It gives a feel good feelings, good sleep. People say that it increases the immunity. And last but not least, there are query. The people who have good regular sex, they have a less amount of prostate cancers. I do not have any proof for it. But what I say, we need a holistic approach. Man needs to be put on the center of the scene. And if we can do this, I think we'll be doing a human service. I'm waiting for a day when there is a man health clinic. They are motivated, educated, and navigated. And time to time, regularly, they go for their checkup. So suddenly you don't find somebody dying. And last Guru Mantra is, sexually fit is equal to physically fit. Friends, I tell you, women are considered homemaker, but man is a homemaker too, but he is thrown out of the home. When he's dreaming about his life, he thinks that there'll be a nest, my wife will be there, two small kids, and suddenly he finds that he's out. He is having a stress, burden, financial thing, even in spite of the partner, earning, everything is on him. And I always remember a movie, Titanic, where if you see the Dutchman, he keeps the rose away on the platform. He is there in the freezing water, and that is what man is doing today. It's an untold sacrifice by men which are never valued. And I'm happy today at the International Day, Men's Day, on 19th November, we are talking about sex. And let me once again tell you, sex not for the reproduction, not for the recreation, but for a relationship which is for the lifetime. And if we can achieve this, Diwali has just gone. We will be able to take people from darkness to the light. We'll be able to kindle the light in many people's area. And friends, I've been conducting a lot of workshops. Thank you very much for patient hearing. And if there are any questions, I'll be more than happy to answer it. Thank you, sir.
Thank you very, very much, sir. In fact, so many things are told in so simple way, and you have brought to focus how actually the man, health in general, and sexual issues in particular affect him, and some things are seen and some things are not seen. And one person who is seen from very close angle is actually the wife or the female partner. I think I have point of view. That way, the men can change their maybe the attitude, behavior, and maybe the setting. That way, they can manage the things in much better. Neena, madam.
Yes, sir.
Please go ahead.
Dr. Brahmabatt, you will
Yes,
have to stop share.
Can I stop share? Okay. Is it okay?
Nahi.
Shruti?
Your
No, somebody's coming to my stop share. Now, please open up. How to stop share? Okay. So, now is it okay?
Yes, yes.
So my young angel had helped me out. Thanks.
Very good evening to all of you, and a very happy Men's Day too. Well, I'm very thankful to the organizers of the Tele Arogya series who have extended this opportunity to me, and especially Dr. Rao for speaking to you on women's perspectives towards male sexual health. I would like to talk on male sexual behaviors. Dr. Brahmabatt has given us wonderful insights. And I would like to tell to you about the perceptions of this complex human being, the woman.
Question answer.
Now, most of us know that a woman is very difficult to understand. And in order to understand what she feels, she should understand her own sexuality and sensuality. Because the sexual relationships would be influenced by all these factors due to which she is developed sexually, or how she thinks about sex, or what she perceives sex as. Now, Dr. Brahmabatt has mentioned about the woman of today who has changed. She is an activist. She's very much in the forefront. She's very much aware of her sexuality. But this would be related to certain urban metros. This would be related to those women who are working, but those who are still in the rural place or still who don't have access to the internet, they still go along with how they have been raised. So the predisposing factors would be what kind of an upbringing the woman had had, whether she had had traumatic experiences, especially incest or sexual abuse. There is ideally no information about sex passed on from mother to daughter. This generation, yes, it is being passed on. But my generation also did not get it. We read about it from peers, magazines, and seeing porn movies. So there's always an insecurity in the psychosexual role. The woman is not sure. If you know that there are thousands of differences between men and women, we do say that they are from Mars and women from Venus, but you have to understand that she is very emotionally dependent and she is very emotive, because a woman's role is to nurture. So she has an emotional package in her. And most of the times when she doesn't get this kind of an emotional intimacy, the sexual relationship is definitely affected. And there can be a discord in the relationship. There could be other problems. If the man is infidel, then yes, it can impair her current relationship. So I thought if I have to talk to you all about a woman's perspective, then we should understand her in the premarital phase, maybe the marital phase, and the postmenopausal phase. Because in all these phases, she goes through a lot of hormonal changes, there are social changes, and of course, emotional and physical changes. And all of these definitely impact her sexual ability, capacity, and her relationship. If a premarital, say a woman in her early 20s or 30s, if you ask her what kind of a guy she wants, I mean, most of us who've been, who are romantic, read a lot of romantic novels, yes, would want the tall, dark, handsome kind of guys, the typical Mills and Boons picture perfect guy. I really don't know if this generation even knows about Mills and Boons or what they read. But overall, if you ask a woman what she wants in a guy, you're going to get a standard answer. You're going to have, she's going to say that I need somebody who is dependable, honest, hardworking, family oriented. And I don't know why, but they always want a guy who has a sense of humor. Of course, if the humor turns on them, then they don't like the guy. But they want somebody whom they can show to their family. They want somebody who's physically attractive. Maybe everybody doesn't get a handsome kind of a guy, but they do want somebody who is attractive. Now, again, two women will not agree to which guy is handsome or physically attractive. If you look at women, and like I told you, they are very prone for details. Plus, they're very stubborn in their choices. So whether it is hair, whether it is height, color, shoulders are broad, shoulders are narrow, hip is narrow, each of these factors affects their choices and therefore affects how they respond to the guy. Whereas a guy wants somebody, if you ask him, he doesn't have so many choices. He wants somebody who will care for his mom and his house, and of course, somebody who has curves, good curves. So being handsome and financially stable is not declared directly to the people, but this is what is there continuously in their minds. So yes, physical attraction must. A woman, if she doesn't feel any chemistry, she doesn't go for the guy. Or even if she's forced into that kind of a relationship, you will find that she has difficulty in arousal, desires, and she just participates in sex because it is a duty to be done. She herself may not enjoy it. So physical attraction plus good personality. Good personality is all these characteristics which we have just talked about. And yes, if a guy has all of that, then he definitely is a future prospect, is somebody who she would invest in. So premarital, yes, now if you look at the younger generation, most of them are not interested in marriage. They are interested in cohabiting, maybe an open door relationship, maybe a live-in relationship, we'll try out for 6 months, let us see if it works out. They don't want to commit. So if they go on a date or they are hanging out with somebody, both of them are desirous of a relationship. Yes, especially females. I mean, they definitely want to continue in a relationship with the guy. They want somebody to call their own, or as some men say, to possess. But if you look at men, then they are 100% wanting sexual activity. A traditional woman, somebody who's, romantic by heart, even if she's not romantic by heart and she's very much modern, but in the heart of heart, she's still waiting for her Mr. Right. When they go on a date or when they are hanging out with a guy, the first thing they want, yes, he should take me out for dinner. He should plan the activity. It should not be just, chalo, let's go. It should not be a fast food corner. It should not be just a cafe where there is a huge crowd. And definitely not a takeaway and then going to the guy's house and then, having the food there. Every woman likes to be made to feel that she's special. So yes, she wants a guy to book a nice restaurant where they can have a one-to-one talk, probably a candlelight dinner. She also expects that the guy picks her up. Now, living in Mumbai with a lot of traffic, people, the younger generation working in all software companies, where they leave the office by, say, 7:38, they go directly to the joint. Pubs are now in, so they may catch the 8 o'clock slot, maybe the 10:30 slot. Both of them come by their own ways, by Uber or Ola. Nobody is there to pick you up, because picking a person up will probably, you may land up next day for the dinner. So there's so much of traffic. The woman also expects the guy to finance the date. There are many who say, no, we'll go Dutch and we'll both pay. But the fun is when the guy pays for it. They also want the guy to make a public statement. Means what? He's to show some behaviors which are affectionate behaviors, something which may have some sexual overtones, like, give her a kiss on the forehead, caress her cheeks, maybe hug her close. And a woman likes to be made to feel that, yes, he wants her, he's desirous of her. And these behaviors, they definitely want. Another thing which they want is that guys should dress up. And even if the woman is coming from the office, she will definitely powder her nose. She will put on lipstick. She will see that, she'll straighten her dress. Whereas a guy just comes with the crumpled shirt. And it is, it is very, very disgusting for a woman to see that the guy doesn't even bother to change. And this is a put off for many women. And this, when they come in therapy or when they're talking about relations, and they say that, I've tried to tell him he can carry an extra shirt, but he just doesn't bother. And why doesn't he want to just come well dressed when we are going out? So this is a question which they do have. Now, what qualities of a man make a woman, attract a woman on a date? We have already spoken of all these things which we have said, what she desires in a male. Now, along with that, there are certain things which women are very particular, especially social skills and manners. How he treats other people. So suppose a friend is accompanying, or suppose I have had a couple of patients who've said, with us, the guy talks well and he's very caring. But then, he calls the waiter and he berates it and he shouts, and the language means, Abe, tere ko akkal hai ki nahi, ye kya laya hai, thanda laya hai. That kind of behavior is again a put off. Because if the guy wants to show that he's aggressive, or maybe that is his normal way in dealing with, because he doesn't want to be nice to a waiter. But if in front of the woman he shows these kind of behaviors, then the woman cancels him in her mind. She expects the guy to be a little mature in behavior. He should have goals and ambitions. Even if he's not fashionable, he should have a sense, means he can't wear any weird color combinations of shirts and pants and come. She feels very awkward if she's in presence of such a guy. And many women complain of personal hygiene. and they talk about bad breath, sweat odor. They talk about, dandruff, and they find it very icky, and they say that, oh my God, why can't he just brush once more, or why can't he just, put a deo and come if he has to come? And though they all want intelligent guys, in this study, the intelligence was rated the lowest. So these were the traits which were studied by Noel et al., and they found that intelligence came way too lower in the list. Now, all these qualities are not only related to the time when you're trying to secure a relationship, but even after you are in a relationship, in a secure relationship like a marriage. And it should continue every time. It should not be that, to impress the girl, these features were shown or behaviors were shown and they just kind of disappear. How does a woman interpret what a man wants? Yes, she interprets very well because men give direct signals. And she knows that he wants, and as Dr. Brahmabatt also said, sex is the only thing on their minds. Getting rid of an unattractive man is not difficult. I mean, women know how to make excuses and how to get out of the situation. The problem comes when they are ambivalent. The problem comes when she's also interested in the guy, but she doesn't want to give on the first go. How does she know what a man wants? From the man's body language. A man takes, he does take effort sometimes to take her to an ambience which is highly romantic. If the setting is such, then he plies her with alcohol, he plies her with gifts. So if all this is coming, the woman knows that at the end of it, there's going to be something else. And yes, men also make direct verbal statements. They can even offer to go and buy, get a condom on the way back home. During the dinner, they will make a lot of statements. If you look at a woman, she's a listener. Very rarely she will, keep on telling the guy, oh, I love you. But yes, you will find that men make a lot of statements. Oh, I've never met someone like you before. You're the best thing that has happened. Or you're the most beautiful person. Woman never goes to say, oh my God, you're most handsome and you're so stable and you're so nice. Nothing. She's very, very conjuice. She's miserly when giving compliments, or she doesn't want to give direct signals because sexual innuendos or talking about it may be misinterpreted by the guy. And so sometimes they do find it difficult to refuse sex, and they cannot refuse because 4 बार मुझे खाने पे लेके गया है, 4 times I've not given him, I've always made some excuses, I feel obliged, maybe guilt. But the man keeps on persisting. I mean, he keeps on whining, he keeps on nagging her, telling her, please, please, I've had a bad day, let's do it, it'll relieve me, you'll also feel good. Sometimes he may give you, apply physical force. And these persuasive skills are, or rather his seduction skills are highly great. And because a woman doesn't talk about it, and men are very pro at talking about all these things because they keep on saying it to different partners, different times, it comes out very easily to them. Women often end up having the sex, though they may not be interested. And plus, yes, she may be wanting to be close to him because she's physically attracted, or there has been alcohol. So alcohol component is always there in most of these conditions where sex happens. And sometimes a woman feels good that, somebody is giving her so much importance. So this increased self-esteem itself makes her, say yes to sex. So often sexual misunderstandings arise. It may happen even in a marital relationship because indirect signals are sent, and we've all heard about marital rape also. Like if the woman doesn't want it, still she has to have the sex or is subdued to the husband. We have said that women can refuse and can avoid, so they already have a lot of excuses. which they practice throughout their lives. This also happens in their marital life. So I have a headache today, or my periods are there, or I've got body ache and I've got work to do. I've got the kids' homework to look at. So they can use a variety of avoidance and distraction strategies. They can turn their face, they may move out of reach. So physical, verbal, any kind of strategies may be used by women. And sometimes this creates a problem in their relationship because they're not accessible for sex. So they don't give sex that importance as much as the man gives. We find this discrepancy actually, ruining that relationship. Women by themselves are very reticent to talk about sex. They will not talk about it openly. They themselves may be unaware of the response cycle. They may have not experienced orgasms, though they are married. And a variety of causes like their own self-esteem, body image problems, fear of intimacy, expectation of negative outcomes, all these actually worsen the sexual relationship. So when I get couples and, I force them that they have to come, the couples have to come, and not only the man should come. He is never willing to get the wife. He says, no, she's in the village, or she's busy and she has to take the kids to school and she can't come. Women who are depressed and women who are having marital problems, and if I tell them, I would like your husband to come because let us discuss and let us see if we can help both of you in having a decent sexual relationship. And like Dr. Brahmabatt said, that yes, sensate focus or exercise, just talking about sex, actually half the problems go away if you're open and if you tell each other what you want. Then the difficulties which they tell, or women say, that, even if I want to prolong sex, he just wants to finish it off. He ejaculates and he doesn't bother, he turns over. He sleeps off. He doesn't wait for me to come. I don't know what to do. And I don't like to masturbate. And how many times I will masturbate. So I don't enjoy sex with him. I would prefer masturbation and doing it in my own privacy. Many times there's no foreplay. I mean, men are, it's like, switch on, switch off. Suddenly, button on kiya, to turant I should be ready. He is already erect. He may just penetrate. It is painful because there's no vaginal lubrication. He does not even talk, cuddle, hug. And all these are the basic things which a woman wants. I've already told you, she's extremely emotional. So all these emotional things are the ones which get priority. So if he does, cuddle and hug her and indulge in foreplay, then that would make the sexual relationship little better. They also talk about men's ego and the fact that the men keeps on saying, wasn't it great? And did you have fun? And some of the women have to keep on, telling them that, yes, they have had a wonderful time. More examples which they give, yes. If I tell them, please get your husband, or if I've given them a brief and have told them that this is what you will go and do, no, I get the responses. He feels it's a waste of time. We don't touch each other otherwise. There may be hundreds of myths which are there. Plus, they may say that he's always with his glass or he smokes before the act, and I just can't stand the smell. There are some women who say that, he's in his Purana shorts, in a singlet. I've got special satin boxer shorts for him. He just doesn't bother. I may put on a dress, I may put on lipstick, I may try to be ready for him, but he doesn't do it. And these are the issues which they feel should be told to men, but they don't want to do the telling. So if I tell them, why don't you discuss? He's never interested. All he wants is, the 5 minutes penetration thing, and he's done. And then he's off, he's on his mobile, he's chatting to his friends, or he's on the TV. So this is a sorry state, and probably we saw all this during the corona pandemic. And so had a number of people who complained about it. And I've had females who say, I prefer to do it with the dildo than with the guy. So these are the things which women talk. yes, some women are not ready for oral sex or anal sex, and they don't want to do it because they may be coming from a conservative background, or they have the husband and wife have not discussed about it. So for them, it is wrong and it is dirty. So all these myths have to be spoken to. All these factors, Dr. Brahmabatt has also said. Men per se are not involved during pregnancy, childbirth. Maybe the first pregnancy, first childbirth, they'll accompany the wife. Later on, the wife, first 3 months, she's to fend for herself. So they never feel that there's no attachment which the wife has with the husband or with, that this is our baby. It automatically becomes her baby. It doesn't become our because the guy is never there. Plus, in our society, men hold or control the resources, especially if the wife is not earning. And she may be told that please don't spend on this. What is the need for an extra scan? I mean, you look all right. You don't have symptoms. So these things, again, are a put off. But sexual needs are demanded. Of course, during the pregnancy, it may become difficult. During the lactational phase, it may become difficult. Or the women may be tired or in postpartum blues. But men do want it. For them, the abstinence period becomes too long. So all these things you have to discuss with the couple, make them aware, make them prepared. And even if they hold hands, are together, share, and foreplay continues, it is fair enough. I mean, the sexual relationship doesn't get affected. Lifestyle illnesses affect both males and females. All these conditions, smoking, alcohol, cannabis, on the rise. Everybody is on weed nowadays. I have school children on weed, and girls are trying out everything. Taking one puff and all, yes, the drive increases, we feel good, and there is increased arousal. That is for weed, cannabis. And if you, there are some studies which say that if you take it more, then yes, it reduces the sex desire. Psychiatric comorbidities are a big part of the couple dynamics, body image disturbances. And if they are on medications already diagnosed, treatment, say SSRIs or antipsychotics, of course, sexual side effects are innumerable. But as a psychiatrist, we probably may not have time to go into the sexual history, and we usually avoid it because it is lengthy, it takes time. Another thing which is noticed is sexual self-disclosure about sexual preferences. People may be bisexual and they may be in a heterosexual relationship, and this may cause a problem or a sexual dysfunction in either of the partner with lack of sexual satisfaction. Sexual desire discrepancy. Yes, they may be on two different poles or at extremes in terms of where their desire lies. So this is never taken into account when you treat a couple. You do not know whether they are at the same pole in terms of their desire. So this has to be studied. So problem areas for women, yes, will always remain as communication patterns, or men do not understand their problems, cannot talk their language, and nor are women able to express their sexual patterns or sexual desires to men. They are reticent on this part. They can talk about all the other 100 things, but not about this. And yes, they are very emotionally dependent. They survive on emotions, and this doesn't come to them in their relationship. This I've already said. And the postmenopausal phase, yes, age is a thing. And as age advances, we do find women retreating into a role where they are happy being grandmothers, not interested in sex, and they will say, abhi pota poti ho gaya, abhi sex ki kya zarurat hai, especially if the husband wants it. The woman definitely is not interested in it. So it is not, it comes only post-menopausal. Actually, half her life she is not inclined towards it or doesn't ask for it because she's never been an active partner. But the study which was done, this is midlife development in the United States, this study which was done said that if a woman is sexually active, then even in a postmenopausal phase, if she has a romantic partner, means a partner who is, there with her, with whom she can share a relationship, has some kind of a communication which is other than sex, and there is a relationship satisfaction, then they are definitely sexually satisfied. And so menopause and aging, in fact, did not correlate. But if they were sexually active, then despite the menopause, they still maintain that sexual satisfaction. How do women do it? Yes, they may adapt to these physical changes. There's going to be vaginal dryness, but they change the behavior. They are the ones who are more into lubricants, use those jellies, use so that they can, they feel better during penetration. They place more emphasis on other aspects of sex. Maybe they indulge more in emotional closeness, and they feel sexually satisfied even if they are not able to have the same kind of penetration as before. So yes, we all want both the couple, men and women, to live happily ever after. And yes, though we want to delete some things and restart, it is not so easy. So it requires a lot of work. And I think that is what, as therapists, we should be looking at. Thank you very much.
Neena, you brought out all the relevant aspects, and important problem is actually many men may not even know that these are the problems. They may know that they don't know how to handle some of these type of things. And one important thing missing is actually the communication. What he feels and what she feels. If both of them can sit, talk, understand each other, things will be much better. I think we have they have done the justice to the topics that have been given, and in fact, why justice? Very, very nice presentations, and a lot of relevant topics have come. Now it is open for questions. Let us just look into the chat box. Many people have appreciated both the presentations. Congratulations.
There are about 7 questions in the Q&A section, sir.
Is it? Where is this actually? Chat box not there.
Question and answer.
Question and
before chat box. Q&A 7.
Probably I could read out the questions.
Okay. Can you do that? I am not able to make out that.
Yes, sir. Dr. Vijay is asking, in sex therapy, is it ethical and legally correct to go and teach the act of sex, or should we only clear instructions to give to people?
Hello.
Yes, sir.
I think excellent question which she has posed. I'll just give you an example that there was a blind couple whom I treated, and I did not touch them. And let me tell you, within 1 year, they conceived. If you have not listened, that, doing those, showing them, there are so many people are doing in India, and which I think legally, medically, I think, morally and ethically wrong. I would never allow those sort of things to be done. This is what I have been feeling, and a lot of people have come into the problem. And I know a case in Gujarat where he came from abroad and he asked his wife and, those two partners, clients, to interchange and show them what to do it, And I think that can be, and it became a big, a racket, and it came out in a newspaper. So I would say restrain yourself. See, sex itself, when I started 40 years back, it was a great taboo. Leave aside other people, my relatives said that you don't have any kuch dhanda nahi mila to idhar gaya. So we are already bad names. So please try to see your personality, your act, even a small act can blow up, and the media will create a problem. I would never advise.
Neena?
Yes, sir. Yes, I agree with Dr. Brahmabatt. We do not demonstrate, show, touch them in the clinic. You are free to show flip charts. You can have your own audio, video presentation, which you can show it to them. You can give them sites which are reliable, but you have to discuss with them their problem, and you have to give them a concept of how to go about it. But in Sensate Focus also, how you will do, what you will do, it has to come from them. They have to understand. Their queries will be answered, but you will not show, demonstrate anything of this in your clinic, because nowadays we are seeing that people do a video recording of what you are telling them, and it can backfire on you. So you have to be very careful of the words you use, and the talk has to be totally scientific. So
commercial artists, students, they use a wooden model of male and female. If that is not possible at your area, get a male and female doll and then try to show them. You don't have to show actually what you can do. It can be most dangerous.
Hello, can I add one or two small points?
Please, sir, please.
The point is, many people are so ignorant about many of the issues. In fact, what I have seen, they may be having a PhD qualification, but he may not even know what actually the anatomy and physiology related. So demonstrating by pictorially, the pictures are there and a lot many other things. In fact, explain to them the issues involved, anatomy, physiology, functionality. These are extremely important. But the point well taken. Sex therapy means it is not either asking them to conduct sex in front of them or a doctor documenting or showing something actually. There are something called as home assignments, what we, in fact, in any of these type of procedures, really explain to them what actually each step involves and what is permitted and what is not permitted and how actually they should go about, and each one may learn in a different way. Say, for example, there are some people who can learn things faster. There are other couple who may take much more longer time than actually what you can initially estimate. So all permutation combinations are possible. All medical, ethical and other related aspects in any medical field is equally applicable to sexual medicine practice.
Dr. Rao, you are absolutely right. What I give them in the first assignment, whether they are PhD or they are architect or anybody, I say wash your hands, go and examine each other, draw it. You can take a help of a Google and come back and show me those line drawings. And then you try to explain, and many people, they do not have ideas about first is sexual anatomy and sexual response cycle. And what she said, Neena, earlier, that they don't communicate what they want. She said that certain anal sex and oral sex, they don't want it. So I give them one of the assignment that your husband, what he likes in the cup of tea, whether he likes a teaspoon of sugar, 2 teaspoons of sugar, whether he likes bread, whether he likes omelette, dokla, whatever. But you do not know what your partner likes. So I make them write that you don't have to talk to me even. Compare with each other what your partner wants and what partner does not like it. So it's a totally Indian version of what they have done and keeping into Indian scenario and milieu in the mind.
I could take the next question, sir. There's one, Dr. Mano Rakesh. Any observation why premature ejaculation is more common?
Oh, yes. See, one cannot say that this is the point, but what I have seen in my studies over here, that in India, whenever young boys start learning about his sexuality, when he is masturbating, where does he masturbate? And what is his main aim? To get an erection, which is very easy, masturbate, ejaculate, reach to an orgasm. He's not bothered about, but after the marriage, it becomes another thing that he wants to prolong it, or when he goes for the paid sex, it becomes. So one of the reason, what behavior pattern is there, which continues. And this behavior pattern, what we do, behavior therapy, requires to be changed. And today, many pharmacotherapy agents are available. So I think it has become more easier. But this is what I would put it. And premature ejaculation is as common as a common cold in India.
Of course, Mahesh Gowda, in fact, I'll try to elaborate one point on that. I think Dr. Brahmabatt clarified a lot of issues, how actually this happens. See, this balance classification, something called primary, something called situational, something called ups and downs possible. But third one, premature ejaculation, in fact, everybody wants to prolong it for a longer time. So many of the times, what actually they claim premature, almost about 30% of the population in the reported studies, that figure is because actually everybody wants to do it for a little longer time. But for that, they feel actually they're early. So maybe understanding woman a little bit and spending on her issues can bring about wonderful changes naturally itself.
Okay, sir. There are a lot of questions. I don't know, Dr. Rao, how you're going to balance, because there are more than 10 in the Q&A, a lot of comments on the chat box also. I'll just quickly tell the next question, sir. What about persons with hypothyroid? taking Theranorm since 30 years. What is the effect on sex?
Okay. Of course, thyroid problem is it can produce a lot of problems, and take proper treatment, it is not likely to produce difficulties. In fact, thyroid hormone not documented any major problem. It is either low or high, which produces problems.
Next. I'll just take next question, sir. Thank you, Dr. Neena. You opened unrevealed feelings of women. Very informative is what Dr. Murugan says. How personality affects sex is the next question from Dipankar.
Is it for
Neena.
me? Yeah. So, like I said, you have all kinds of women, and personality plays a major role. If you have somebody who is a little bold, dominating, having cluster B traits, then you might find that she is more sexually active, more vocal, as compared to somebody who is, a little reserved, shy, cluster C traits, and you're going to have a lot of problems for that woman to open up and demand for sex. The type A, the group A, the schizoid and the schizotypal and all that, they are going to have other problems in their marital relationship. We do not know if each and every woman will suspect it or no. But then there are again people who will not be very receptive to the sexual relationship. So if you're looking at it in terms of which kind of personality trait would help with the sexual relationship, then I would say, yes, it would be cluster B, and cluster C, you can make them go ahead if you talk to them about the problem and they are open to it.
Okay. Ma'am, there's one more question. Several fathers, daughters who have ruined marriage life. I don't know what's the question that they want, but it says several fathers, daughters who have ruined marriage life.
Even I didn't understand.
Whether they're talking about incest and related things, fathers have spoiled the daughters.
It looks like it's a Rorschach test, sir.
I think we'll move to the next one.
Okay. Dr. Aninda Sidana wants to know, you told us about intelligence being the last thing in dating and marriage, but these days most women and men describe themselves as sapiosexuals.
Well, that was in that study which I gave you, the Nora et al., when they interviewed about some 2,500 women. They found intelligence had come lower on the list. But overall, I do feel women want men who are intelligent. I mean, if you can't have a straight conversation, it'll be difficult to progress, forget sex, in anything else. So not all women are looking for somebody who is, their pair ki juti kind of. It's not that they want to dominate the guy, but they definitely want the guy to talk sense. So if you ask me personally, then I would rate intelligence higher up than what they found in their study.
Dr. Aninda also wants to know from Dr. Butt, can there be any manual or material for sexicide developed by Dr. Butt in Indian version for Sensate Focus, and where to get it and read?
No, to be honest with you, as I said, I conduct a lot of workshops, and I always say that it is not a, that Kapoor or Tarla Dalals, make a salad, cut a cucumber, cut a tomato. It's a very dynamic process. I'll tell you, no two cases are similar. And every time, as Dr. Rao has said, that there is a roadblock. There are homework assignment is given to them, what they learn, but that pattern is always there, and it again depends upon couple to couple. Unfortunately, I had one girl, I remember, that she was, sexually abused by her own brother, and he has abused with the, touching her breast and all those things. So for her, when the breast caress came, I had kept it the last thing to be there, So those sort of a thing, or the woman who has undergone a mastectomy, or there are religious. One very interesting case had come, that that the couple was coming from a dominated Muslim area, and she was the eldest, it was a joint family, eldest person in the family, and she was not doing the homework. Then when I asked, they said, fazal ki mane, the first namaz when we have, we should be clean. If you have touch, and if you have anything around sexual thing, we cannot, and I have to take a bath. And if I take a bath, then all my, elder sister-in-law will come to know. Now I had to scratch my head. And I gave them a next time solution. I do one thing. When you are cutting the vegetables or making some bhaji, just tell her that nowadays there's a lot of it. So every day I have decided to take a bath at 5 o'clock and then pray namaz. So, it's a very dynamic process, but there are definitely patterns. There are, as I said, 8 to 10 sessions, and sometimes it's very difficult to, because you are talking with somebody's very innermost feeling. So I say it's a more difficult than any dharma guru, this particular thing. And unless there is a bridge and trust developed between you two and your personality is very important, that you should be absolutely sexually comfortable with yourself. And no matter what happens, what they have talked to you is going to remain totally secret. Once that comes up, then they open up. So I think there is going to be and maybe it's learning. You'll be surprised and shocked to know, just by touch, I teach them 7 different ways of touch. And what our Vidya Balan says in that dirty, what was that movie, Dirty Woman or something, she says, what sells is entertainment. And I say, what works in sex is sensuality. And sensuality. So unless those touch, it takes, sometimes 4 to 5 sessions to understand what different type of touch is there. And that sparks the, light, and it creates it's a beautiful dynamic thing. I've been practicing for last 40 years, but every case gives me a lot of, challenges to work with it. It's not a Sarla Dalar or Sanjeev Kapoor's work.
Sir, all said and done, this may be eclectic, but all need to be documented and published.
So that is why I have made Dr. TSS Rao as my Manas Putra. So my work, and as I have promised him, my books will go to him. And today, Neena, I'm telling you, I'm so happy with you. And if you are interested in sexual medicine, I'll see that you become one of the best sexologists or consultant sexual medicine in Bombay. I would wish. There is a great need to have those sort of a people. And yes, we will do it. Don't worry.
There's one question. There's one question wanting to know about the basic qualification for practicing sexology.
Dr. Prakash Kothari says, if you are married and if you have produced children, you know about sex. So don't worry about it. In this country, anybody can be a gold medalist. What you need is from any branch. Today morning only somebody called me up from homeopathy and they said, sir, we would like to have classes and we would like to learn. So anybody, because they got 2 or 4 marks less, does not mean that. And here in sex therapy, as I said, it's a behavior therapy, supportive psychotherapy, understanding what is going on behind 2 people's mind, sex therapy, and along with that pharmacotherapy. So they can use their old pharmacy. So I think, basic is any medical graduate can do it. There's a confusion between counselor and can a counselor act as a therapist? No. The therapist gets a chance to touch a person. Counselor cannot touch a person. These are the 2, as my definition, if I would like to put it, But they can always counsel.
The question for Dr. Neena. Outgrowing sexual needs, women and men, please throw some light on the context of self-realization and actualization.
Big thing.
So what, I don't know how to answer this.
Correct.
But I don't know, somewhere women, I don't know when they will reach self-actualization and self-realization. Men have reached it, but I would still say that there is hope for women, and they are understanding it. See, now, though we say it is, a basic need, if I go as per Maslow, it comes as just the bottom of the pyramid, where it is a basic drive, where it is a basic need. Nobody looks at it that way. In life, yes, we want to go ahead and we want to achieve goals. And I always feel like Freud had said that libido gets invested in something else in order to achieve that. Now, I really don't know how true it is or whether Dr. Rao or Dr. Brahmabatt will agree with me. But this is a change which is coming in women, which I find that though she's coming out in the world, the sexual needs are somewhere forgotten or maybe just when they need it?
No. My perspective, as I said, very different. My wife is here. She will tell you 80% of my cases, they find it out my number and they literally drag their husband. Today, they have become very vocal about their own. And let me tell you one more thing. All the males, I will say that we are all hypocrites as far as the sex is concerned. And female, they are more open, more straightforward, what they want and what they don't want. So I respect that way because they are very clear about their sexuality. While men, as I said, their whole investment is in their penis and their sexual act. And I say so many times, it is better to live with a sexual problem many people feel than to admit that I have a sex problem. So somebody other day was asking Dr. Rao, he says, how much indemnity you have? I said, I don't have to worry. He said, why? Because nobody will go and say that why they have come to me because they had erectile dysfunction or a common language says important. I was important. Nobody would like to say the court that I was important and what worse I can make it. So I think, women are coming out to be, and you were saying me, but me and I had a rich experience of 44 centers across the India. And right from villages to slum to rural to, and they are more vocal. They have more space. In Bombay, tell me if somebody wants to enjoy sex, which is the space available? One cannot go to those shady hotels and spend 2,000 rupees for 2 hours. So in Bombay, it is, and I have been to a smaller town, and even if you see India Today's survey, you cannot, because they have more time. Our 1/3 time goes on the road, going from one end to another. So there is a question of sex. People who are staying in Vasai Virar and when they are coming from all the way working at Churchgate or Kolaba, they would like to go to sleep rather than have sex. So these are the things, unfortunate part in city of Bombay or metro cities.
There's also, yeah. Yes, ma'am.
I would just like to say that though women are, the women who come to me with a sexual problem, if I tell them, let us work on it, they say, let it be now, it's okay. I mean, it's just one of the areas which I feel I should discuss. But I don't know, they are not very participative.
No, you gave an answer in your talk, very nicely you brought out that foreplay and respect is the most important part of women. All these years, they were treated like a dirt, wham, bam, thank you, bam, the middle of the night, he gets an idea, gets an erection, he is less bothered about the foreplay, penetrates without the lubrication, and she thinks that what she wants is a label. एक बच्चा हो गया बाद में जिंदगी भर सेक्स नहीं होगा तो डॉक्टर चलेगा, and that is the story of our women today. But if you tell them that it's because they have never thought that it's an enjoyment. In 1985 there was one paper who was given in Delhi 7th World Congress award. So it was on female mutilation, and she presented, she said an African lady, they asked her if sex is enjoyable, the 72 years lady, she started laughing. He said, where is the enjoyment? We have never thought it's an enjoyment. So it's one more task for them. So they think that it is better, and then there are myths for if they are around menopause that it is end of their sex life. That is what happens.
Dr. Rao, you need to tell me how do we go about, there are at least 10 open questions.
Yeah, see, once you start sex, you don't usually stop somewhere in between.
I agree.
There's also feedback. There's also feedback saying Dr. Rao is not his usual sexual self in moderation and he needs to be better.
See, in fact, when two stalwarts are discussing why this thing, I can keep it for a little while. I don't mind a few more extra minutes. I don't think other people also, unless you have a limitation that it has to be stopped.
The Dr. Rao believes when there are murkha people are talking, murkha means senseless, it is jnani people should remain quiet. That is what his motto. I know him very.
See, each of the areas been discussed needs, see, for example, many men who come for treatment, it is because the women have told them go and get the treatment done.
Absolutely. Right.
Many men come and tell us that my wife doesn't know, I don't want to bring her. But she is the one who is actually involved with him, and not knowing means it is his own myth and misconception, actually, what actually he is carrying. Few more questions, definitely we love to.
There's a question on how do we manage the differences in sexual needs or sexual needs gap?
I think we'll ask Neena to answer, or Neena?
Well, every couple you have to talk. I mean, both in the first place, it cannot be that you talk to male and female separately. Either of them comes for a problem, you have to call both of them and you have to talk communication, communication, and communication is the only way you are going to lessen the gap if it is there. And the more they understand about each other, preferences, what they like, what we talked about, sensate focus, I feel it is not to be given only in therapy of, say, importance. It is to be given as a general therapy to all couples for improving their sexual relationship. So when you're talking about all the sense organs and you're talking about how touch is important, you might find that the sexual gap automatically decreases because now the couple is more open and is sharing. So that is what is more important. And they should not have inhibitions about sharing. They have to be comfortable, because talking sex is something which doesn't come easily to all of us, even if you may be married with children, whatever. So somewhere you have to start that, and the therapist actually helps to ease that gap when he allows them to share. You can suggest books, you can suggest videos. So there is a lot of material which is there now, which will help the couple.
See, different.
No, I just want to add one more point there. See, there was a very big study which came up in, it was published in Clinics of North America. See, only about 1/3 of the women, about that means around 29%, who experienced something orgasm in intercourse situation. For almost 2/3 or almost majority of the women, it is actually the touch. In fact, I almost always emphasize it is, in fact, Dr. Brahmabatt also used that word somewhere in between also. It is touch, touch, and touch. See, before, during, or even if he has ejaculated after sex, in fact, a woman can be taken to the orgasm. So there are few of the things actually what they have to learn. And as a therapist, it is the responsibility to see that you take both the point of view and make them understand, realize. And there are quite a few men who are willing to change. See, they don't even know what actually happening. And that is one of the difficulties. So that's where actually the sex therapy has a significant role to play. And even, say for example, not necessarily medical people, even psychologists, sex counselors, in fact, they can make a wonderful change by just understanding that different perspectives needs attention.
No, but they are most difficult cases to treat, to be honest with you. As I said earlier also, woman wants the status, the matrutva ho gaya ek dafa, so then she is respected woman. She no more a wants. Secondly, man during the earlier days, his whole attention is in earning. The sex does happen, but it was not major. And when he says reaches to the top of his life, suddenly he realized that sex need is there. Do factory, gaadi, bungalow, sab kuch. And at that time, the wife she has never enjoyed. She has been treated like a dirt, as you said very rightly. And this is the time she goes into some spirituality, and some Baba is always available. So it creates a very serious, and I find they are most difficult thing to treat, because they have already gone on a different path. And there for a man, I said, he feels like killing himself, banging the head. I have seen those miseries of man, you cannot imagine. Because when he wants, he wants. And he is monogamous, he wants a relationship with the wife. And if it doesn't give, then it's a big major problem which occurs,
There's one more question for Dr. Neena. How do we manage vaginismus?
It's a separate a separate lecture by itself, and there are multiple causes for vaginismus. So if you will have to understand what the woman is, what are her fears, and the psychological factors play a major role in vaginismus. So until we understand those fears, then only the therapy can start. So vaginismus and dyspareunia by itself is a separate talk by itself. That is all I can say. I cannot answer that question in one go.
Okay, there's a question for Dr. Butt. They want to know the role of sex toys in therapy.
The sex toys, to be honest with you, I have not used in my practice, fortunately. And I would say there is nothing wrong about using the sex toys. As I gave you an example, it is safer to use the sex toys, And nowadays I'm finding the change. There are many men who has brought one of the sex toys which has been approved by FDA is Eros, which stimulates the clitoris. And many men have given their wives, at least I know 3 cases where they're given for a long time. When they're away, they said, you take this and use it. So sex toys, there was a beautiful video which was shown in at the Khajuraho conference, and one elderly lady has been caught with the sex toys by the custom people. And then she says, my son, who is mentally retarded, is physically unable to have sex, and for that, it was a very painful. So I think there are lobbies which wants to make the sex toys a very available as a need. And as I said, right from the Vatsayan's time, he has given a dildo sort of a thing, not a vibrator, which is made up of either wood, brass, jasat, silver, gold, and ivory. So you can imagine that this has been there for ages, and particularly doll. I have a lot of patients who are abroad and they have been using doll regularly, and it is safer to, and there are different types of dolls available. And recently, so I would say that it's a topic which needs to be discussed in a big way, in a good forum, and give a recommendation to government that it should be available on a prescription. But if you go to Bombay, everywhere, I think Dr. Rao knows, we have gone many times and we have seen that they are easily available.
There's one more. In fact, okay, Neena.
No, so I have a number of patients who have dildos, who use it, who also have harness, and if the guy is for it, like sometimes if the kinky sex, or if they want to do something different, then the guy, female uses the harness and then tries to push the dildo in the man's anus. So this has been tried by some.
Mahesh, 1 minute, Mahesh. One more point I would like to add to what Neena said, that vibrators particularly, they are all battery operated. You can change the frequency. Man can never match the vibrator's frequency. And if a woman has used, then he will feel that what I have got is the most useless person in my life who cannot do anything. So I think it should be told that this is a different and this is artificial and what is normal.
Even I would like to add, in vibrators, see, they may not go to the chemist to buy Eros. Correct. But normally for our massaging, we usually have some, for facial massage, there are small vibrators which are there, which are available as a facial massager. And I've had women, in fact, even suppose, you have back pain and you have one vibrator with a very broad base, and they use that on a clitoris, which is, so much of surface area, which makes the clitoris very sensitive very soon. But I've had women who do this kind of a thing. So, you have to tell them that it should not be a broad base, even if you have a facial massager or anything.
I remember an incident, Dr. Solomon Terence, who along with me in 84, in a President Hotel, and he came out from their shop and he was so happy. I said, what? He had those massager vibrator and he said, I have never seen this and I'm taking back to London. So you can imagine, you are very right.
I just want to bring this live toys. Every man has actually 11 toys in his body. In fact, what women can make use of or he can use. One is the center. In fact, what Raj Brahmabatt was talking for pretty length of time. Each and every finger can be used as a toy. In fact, this is what actually the message that need to be conveyed.
But one message I would like to add it, the Guru always keeps something in the end. One fellow came to me, and during those days, erectile dysfunction was not the word. They said, sir, I have become triply impotent. I said, how? He said, first of all, my centerpiece is not working. I said, fine, that is one. Second, he said, my middle finger, it has, fractured. I said, agreed. What about the third one? He said, yesterday, by taking a hot tub, my tongue is burnt. So I think there are different vibrators available God has given us. One should know how to use it.
So there's also one more question as an extension. They're saying, possessing sex toys is okay, but if somebody is not selling it, how do you actually possess it?
These are, questions which you should ask the custom and police department. Everything is known under their, I think knows everything is happening in this country. So I think that's why I said we need to have a forum and discuss it out and bring it that it should be available on a prescription.
See, one of the things, custom people usually they block it, but all said and done, once I still remember I was traveling from Argentina, one of the World Congress was there. We had packed a lot of things, but then they checked in when I explained to them I am sexologist and this is used for some particular purpose. In fact, they also can be considered sometimes. In our law, in our country, there are so many laws are there, but I don't think anybody is being persecuted for this particular purpose.
In fact, I call a quacks and there are qualified quacks. So I know of somebody which I cannot name and never name in the life, but he used to buy dozens of vibrators, and he used to give it to those women over there in a village, women, and give them and sell it at a higher prices. So these are the types of, unfortunately, so there are quacks and qualified quacks also. So this branch we need to be very, and as I said, that it's a branch where you need to be first, make your own personality, make your own character proper. Even a small mistake, even as you were saying that showing some, not if you have an educational video, then it's okay. But if you show something else, they will say, "Ye doctor to porn dikhata hai." So you have to be very careful about your prestige and work.
Sir, one last question we could take. Sir, it's already 9:20. They're asking what are the commonly prescribed aphrodisiacs in allopathy?
Who would you like to answer? Me, Dr. or me, Nita?
I don't prescribe.
Okay. I also don't prescribe. People have been using alcohol, cocaine, marijuana, Spanish file, lizard oil, horns of animal, ointment, ginseng, shilajit, amphetamine, LSD, oysters, and whatnot. And Sandhya tel. And in Bombay, what is available is
Ashwagandha Rishta.
Palang Tod Pan at Chowpatis.
Palang Tod Pan.
400 rupees, which contains cocaine. But the best aphrodisiac, what Vatsayana says, is interested and interesting partner. There cannot be better than this. I think this you go through Kama Sutra. I have gone hundreds of times, and every time I dig out something new. It is beautifully said. Can interested and interesting partner.
True.
That's that's more than enough.
Over to Dr. Rao, sir.
Okay. Of course, we had excellent session, and keeping that time constraint in mind, see what actually this particular presentation brought out is health is one of the very important aspect. And there is one definition which people have claimed, which actually says that man is healthy. If he is hungry, he is horny, and he is happy, he is healthy. See how beautiful it is. In fact, so sexual health is one of the extremely important component of overall our living. And we need to focus. Many men neglect their health for the simple reason that they are busy with the work, busy with power, busy with responsibilities. And this equally needs to be looked into, is one of the message. Personally, I'm really grateful to Dr. Raj Brahmabatt taking time off and be with us. And in fact, Dr. Raj Brahmabatt completing the session in such short time is a very unusual phenomenon. Like sex, it goes on for a long time. And
40
Neena,
years of experience. If I take 1 minute, then also 40 minutes. And fortunately, I forget that Devda's name, which is recent, but the past memories are so intact, thanks to God.
And Neena, I have heard her, and each time she is
amazing.
Is something, it's a visual treat. It is a treat for ears, treat for...
and beautiful slides.
Brain.
Thank
Beautiful.
you.
Thank you very much.
You have found out a diamond. I would say solitaire you have found. I'm happy.
Oh my God.
And Mahesh, you
Mahesh
did an excellent job.
Has been doing great service, and so also his team, Vijay, Harbishettar, Jagadish, and so many other people involved in this. Personally, and on behalf of the panel, and I think all the people who listen to us, thank you very, very much. We really enjoyed ourselves, and I think we have contributed in a small way, whatever.
Rao, I asked Mahesh, he's also from Mandya area. So Mandya is, I think, apart from the grains, it develops a sexuality in the best way. I would put it that way. So research needs to be done over there. Bye-bye. Take care. Good night. Shabbat.
Thank you.
On behalf of Tele Arogya team, I would like to thank today's resource person, Dr. Bhatt and Dr. Neena. I would like to thank Dr. Rao for actually actively coordinating and setting up this program for us. And what a treat on International Men's Day. We really had our times, remembered for this occasion. And every minute was enriching. And all three were at your best. Only feedback Dr. Rao had was he should be better in moderating. He was not sexual, is what he said. I think next session is going to improve on that. I thank each and every one of you who have participated. There were more than 200 at one point of time on Zoom, and more than on 70 on the on the YouTube link. So it was really an enriching program. I think it's reached a lot of audience too. Thank you, everybody, and have a good night.
Good night.
Thank you very much.
Yes.
Thank you. Good night.
Okay, Dr. Rao.
Thank you, sir.
Wonderful,
thank you, madam.
Wonderful, madam. Okay. Take care. So we'll talk at night or tomorrow, whenever you feel free.
Sure.
Okay, bye-bye.
Thank you, then. Thank you very much.